alaikum baɗigol mbala kon toon kan jankotenke GRTS na health check programme o toon kamin natali talata sira lem be siri jambi fana bidum kacha dum be kumayala bakele mi yalon ko ning minul be kacha nyin sotola wolem Dr. Cherno Jaloti atelem pediatric surgeon at Edward Francis Teaching Hospital aning Dr. Bia ngalon wo sayal data my partner in my co-presenter Dr. Jallo mbaflali assalamu alaikum ko tenkena health check program
abarka thank you for having us
Bia
abarka baka bi won nata amisod le to yana jan
aha ni ko amisod mo jama malum munem amisod ani munatina anata
na je ko na banko kan mol bi je mi alan ko sorata operation wala banko dulal je ko kabo banjul kala ko koyna bar na je ko lopitan wol fana min se nyinkeno imantara dulal je to andum operation dol bi je ni koy bo sota fo na fo banjul so to la hamo min to wala gambien wol mi alan ko dogo ke operation silo to wala surgeon wol ti anesthetic wol min ka dogo ko theater to wala na ta nyokan burka ka fo fo mi alan ko ebe tala satel to banko kono ka banjul kata fo basse ka mul kenyo kan ka operation o dila mi alon ko ka operation o ke free of charge mi alon ko te joro kala so wala na amisod lota amisod mu Dr. Rajamane International Charitable Foundation wolong foundation timi alon ko Dr. Mane la nyaton kaya
so ateni fanan ni miralo nata abidiyala no bake bari ngamre se je jabe no munatina ni mira bari yafale ko mo jamal katara e kala fi operation o lale buka soto surtout mol mi yalon ko be jamfare minul be basse ma fango bansang soma nyot yalon ka bunanje kana jam pro kana sojiri sota aka time ta fabre ngamra la sojiri liso fango le siata mol min be nyanta soto la siata
hani loptan balto bayring daning operation abekala sarto lebeje mi alon ko nyanta timandela anu fana mol mimbe operation o kala amanke ko mol be la kake sasa operation sasa min so operation wala mol le so mi alon ko bo sifal kala anu wol fana imansia bake so ila rango nyin ka jam fa bakela so dandi be isoto la no public hospital oto rango nyingi ka meatol la ne be futal so wo fam mo mirol te meat na ay mol sembentu yande pour na nying kafo nying fom wala be nying rango nying suti ande la nyame ngan fanam be operation on suti ande la mol la nyaadel.
Today we having the discussion on AMISOCH, that is Dr. Alhaji Mane Charitable International Charitable Surgical Foundation. This is not charitable, medical charitable foundation. This is surgical. Dr. Cherno, welcome to the health check.
Thank you for having me.
And can you please tell the viewers the meaning of AMISOCH and why?
What happened was there is this young man. He's a surgeon. He's with us. He's a specialist in the teaching hospital. He's the one who came up with this concept, with this idea. He's Dr. Mane. So he, after observing that most of the patients come from the villages, the districts, out of his wisdom, he felt there will be a need to go get closer to the community and then conduct safe surgeries. So that was the impetus for the formation of this charitable organization group. So now we are added ourselves into the group, and then other surgeons, nurses, perioperative nurses, anesthetists. Currently, most of them Gambians, if not all, and then they all coming from the teaching hospital and then the Kanifing hospital. So it's comprised of all these people. So what we do, we go to the community and periodically conduct safe surgeries on conditions that are common, surgical, some other conditions also that have been lined up in the teaching hospital. And then we know it's cheaper, it's better for patients to be operated in their locality than traveling all the way to Banjul or Kanifing, where some of them may not even have a place to stay. So it gives them better outcome, and then economically it's more viable and more sustainable. So this is what AMISOG is all about. So we go out into the community, we set up a camp, and then we operate, we do safe surgeries, then we come back. So this is what the idea is all about. So it's started from 1 month, and then this is the one we are going to do on the 29th. That's on Friday. We're going on Friday to Basse, and then we'll conduct the surgery on Saturday. We'll come back on Sunday. So it will be the 5th edition of these safe surgeries we conducting. The first one, I think, we conducted one at Brikama. We went to Soma, we went to Farafenye, and then we went to Basse before, and then now we're going back to Basse. And then from there, probably if we exhaust the country, we may go to Guinea-Bissau, to other regions. Yes.
Why Guinea-Bissau and other regions?
Gambia may be seen as a small country, and we've been receiving a lot of people coming to support us. Yeah. So if we exhaust our regions, so the onus is on us too to go out to other countries in our places in our sub-region to also support. Yes.
Like you said, the surgery will be done in Basse on the 29th of this month. That is Friday. So which kind of surgery are you going to do?
We will be doing various surgeries. We will be going with general surgeons. We'll be going with urologists. We'll be going with obstetrician gynecologists. We'll be going with some pediatric surgeons, and then the other surgeons, even orthopedic, some orthopedic surgeons, so maybe included. So it's different subspecialties will be coming together, and then we'll be going. Then among them we'll be having perioperative nurses, and then anesthetists, as I said earlier. So some of the conditions that we'll be operating will not be limited to, but it would include what we call lumps and bumps. Like if there is any swelling, what we call the groin, some will call it kalia in Bandinka, we call it hernia. If there is any mass or any lump on the body, we will do those surgeries. If like there is fibroids in women, this surgery will conduct. Hemorrhoids we will do. Yes, so while we are there, in fact, it will not only be conducting surgeries, we'll also do screening while we are there. And then any region we go to, for example, we're going to Basse, while we are there, we take over all the health activity
for that day.
For them,
for that day.
Any pregnant woman that comes, instead of being brought to Banjul or Kombo, we do the cesarean, we do the CS there. Yes, so any trauma or anything, we do it there. And some of the conditions that we will diagnose, and then we not able to do them there because of some logistics problem, or it's a complex case, we will then send the patient to Banjul. When we come back, we'll follow up the case and then make sure the patient is operated.
Okay. Thank you, Dr. Cherno. We will come back to you. Come, BI Cherno ya Funyamin. Operation on Fenko Tanying is on the 29th. Tenyinem sinya lulute. Abekela, Bansan Keta, Birikama Keta, Farafenye Keta, Basai Fatan Keta, Aketa Kotenke, Soma Fanan Keta. Munati na fang Basse Muru fang Kotenke. Parce que Basse Keta.
Yalong near Gambia GB, amanke operation o kakino dula bil. So ngandola kadamen choose walang loptan wal mi along ke warta theater sota mi along ko operation o kino ji. So niya je loptan bal nyumbe resate kono jama bal mal. Data fon hani loptan ba Banjul na operation o konan ke je walang momin tambita kemela na operate Banjul fon da. So wala na bari na region last one o regional de mrunta kote kata URR fananto and same thing URR kono basela se income sifa hosno kata manke camp dente specialty jamal le kana and ngotil kilingo to mol minka operate no all of time dingol tewol talano and wol fanam mang theater soto min se kino so wala nana basa choose kote and then be muruna na loptan dul fanan kan inshallah aninka ta bankol to comme Casamance kono anin Guinea Bissau to dul kan nañu service o fotandi ji fanan wolon
pour kata ko mul kana nyame Gambia ja altul fanan be fintila wala nyama kata ji bari nga jele comme bi ni momi be jubero la ibenna health check programme no makan ilafta idabula la ibe base lafta idabula la nying operational kono ite ba kala nyaadile ani mun condition sifa wala sasa sifa le be nyante mutala foyete ye nanan e ko lafta operational
sasa mi alon ko be min operational kaje sasa min ka dinnol mutamin so to operational wolong ika fami kalia ani binne ndol min ka ning bata kunta yitul so to mi alon ko ibe solo operational ak ke bal fana operational ne la kalia la ning sunjul mi ika fami lamp wolong ay berol so ta kono mi alon ko asi operano and ika fami fana hani berendol min kata wulu nyawal kono mi alon ko ika modol bali kono soto la adika dol ika tinna dol fana yellow ila ada yellow kamin jaka siya baka wol fana opera la
wolem fibroid
ika fami fibroid be wol fana opera barabe ansa long ko amanke mobile se opere no ning opero sartro bela momo ba jibela la nimba operation on kala nata operation sartro bala wolong yellow manke amansa sa do sato en call opera katum fenkilim je wolong operation on opera kala murula la momo kan nyanta kala safe surgery omun principal kilin so womo ni nyanta jibela so sente momo be basa lafta pour na operation on nyinka asetano basa loptano to namara flyel fana be kala screen to pour alsala be nombal min ko la alsetano basa loptano de nyanta tesol kala landing opero kadite na la no sibiti lungo ya fam bi
be operation o kala
so danding sibiti lungo iseta basa so doctor role min be je wol be jibe la sa role jibe fo nyese opero no fata opero no then ila kaytol ta lungol fo mi al ko nyanta na la lungo min so on sena opero ke so mba kala wol nyama nyin sibito min kana inshallah
fo comme alka operational min keten alka ta dulalto fo abal mako ila le jang l'hôpital bato pour kala do ko talaba
comme amanke fongo do ko talata min gana kuma tan tolta wala pour na mole service o soto mi alan ko service kendolon anu fanan ay e ka fami operation wait time ay o fanan tala baden ni moja sasata aka anyanta bola basaka naja aka tani na jamal kala katum ibuka na lungo minna ibuka sasa soto lungo yeta o so me opero soto na man ka emergency so nafaka nyim fanan tala na mol min ka bonan dula jamota kana fojan badin ka mol jale ka bosate do te kana jang andum expertise bi jan mol bi je mi alan ko ila karamo fotata makama balto mi alan ko se nyinkeno so itol fanan ya jale ko bet nsatano na mol kanne na ni operation o kino for free na dunu nyintala na mol fanan wala nan kaninka
abaraka bake biya mbe murlane kanne parce que kachani akuma yata ba parce que kajele sañ mol sasa siyata mol sasa tale mol man kende ya dol bi jele fang ibukalo mune ketela ka tusu ko janibe futala lopitano to waya tara masibo kata ite lopitano man katela dol bi jele lopitano jam fatila le bake jani balo na min bila dron where Mantoro Kete Bala Fa Pareta.
This is a charitable group comprised of locals, Gambian surgeons, perioperative nurses, anesthetists, who goes to the different regions to conduct safe surgeries. As you know, surgery is expensive because it involves equipment, consumables, and going to the district would involve transport. Because when we are going, we go sometimes up to 30 to 50 people. So transport, consumable, these all of these things, accommodations, all of these things are expensive. So now, because it's a charitable group, so it's the members who put their limited little resources together, and also some Gambians who are patriotic, who feel the pain of their people, also come on to also contribute, and then some of them really contribute handsomely. For example, the last one we did in Banjul, where we did about 103 surgeries, very different type of surgeries we did, and one of a prominent Gambian called Hamid Jah contributed immensely. In fact, almost $1 million was given towards that cause. And then I know there are a lot of Gambians who are able, and then who would really love to spend on this cause. And they did it before. For example, TAF, if you look at our Demban hospital when the COVID struck, TAF came and then he helped in renovating the place at no cost. And then some other Gambians also contributed. So we know there are people here who really be ready to contribute in this type of cause. We are calling on them. If they're listening, they're hearing us, they can come forward and contribute. We are not looking per se cash. You can contribute in kind. You may say, okay, we'll help in transporting all the staff or the volunteers to Basse. You may say, okay, we will help to take care of the accommodation. You may say, okay, we will help with the feeding, because all the people who are going to take part, they don't expect anything in return. Everybody is happy to go there, conduct safe surgeries, and come back home. That's the happiness. That's the only pay the volunteers are expecting. Nobody's expecting any honorarium or any kickback or anything. It's all purely based on humanitarian activity. So basically, this is what the thing is all about. It's so amazing.
Health is everybody's business. I think we have to come together. As you say, not cards, but kind. You can even help. Maybe some people, they did not know. They want to do it, but they did not know.
They don't know. It's true. Some people probably have the thing, but they don't know where to spend it, on how to spend it, because everybody wants to be associated with something that is legitimate. And then this is the 5th edition of this activity. This is not the first. And then for example, in Soma, we did about 35 surgeries. Some of those patients have been waiting for years, and they were not able to have surgeries. I think we did, like in Soma, we did about 35 surgeries, and among them, about 4 fibroids were done. We did children, about 8 children were done at that time at Soma. All these,
and we also did emergencies.
And then we did the emergency cesarean sections. Those patients would have been brought all the way to Banjul. But while we were there, we did that. So it's a legitimate cause. And
most of the patients they will not have the money to come up to Banjul.
It's a fact. For example, in my clinic, I conduct my clinic every Monday. That's the only pediatric surgery clinic in the country. And then you realize people come all around all the country, corners of the country. In fact, a lot of patients come from Senegal,
the most amazing thing is this surgery, not only Gambian patient you normally have. Sometimes you'll have Senegalese, that border areas.
Yes.
They will all come.
So the last one we did in Basse, when we looked at our statistics, we realized more than half of the patients came from Senegal. Yes. But because we are a charitable group, and then we are colorblind on race, on tribe, on religion, on locality, we are colorblind on all this. We don't, in fact, it's not part of the thing we even look at. When you come and then we diagnose you, we prepare, we screen you, and then we know you are safe to be operated, we operate you with the help of God.
Biyai, comme Dr. Cherno ya ko nyamin dro mo jamal bi jele mi yalon ko ñing operation ni nata ibuka albuka jube bota mun to dol ka bonang wo dandandala te wo dandangol sometimes dol mi yalon ko Senegal ni Gambia bolale mo jama ka bonan jere parce que hakilo ba kan kabrin tata bansang nga do interview no nga kate botalan Senegal amanke mo kilim fangote
kaka wol nyama hanin ka kam dol fanan soto no santul do mul ka bo kabrin kombo jang kamul no makana fo basse wala kana fo bansang katon hanata rebe janne operation o natra be banjulle parce que no rango sa jam fa ete men jola da sial bal ni operation o ni koy be kala private hospital o operation killing asia akasia bakal ni aje kodo min ka safe ni operation o bearing patient o bukana fen joji ka min spende wala mul kamen donate anen tol fan kamen lano nyokan so ikaje ko kodo ni a calculate ni operation o ni hakolti ni nata calculate by the total na minke e ka joka si ata bakel by the mumu tata mi mo keme opere min si ata mo keme ta per weekend killing auto so ni o janata jorol nyanta kala wala be kala ko di bal tan no mo jamal be je te ñing afford la no so wala operation o ñim kuma yata bakel
te dol bi jele fang mi yalon ko ni nata fang katara ibe tarala dame fang wo fanan ka ke problem dole te imam badin soto jang ima soto ibe min domola yalon wo fanan ke batandile wala tan nyin sifal aka bete yale ali etaje bari fanan kom ka fo nyame nga fo nyame jata kende ya manke masakunda dam mata mbele nyantam bulo ka fula nyoka ngaje ko nyin sifal nabe kirin comme ami so la ibe nyinke ka mo se wuli do nga safa ko nteng de man ko do soto de bari nga moto soto le mimbal sambala yal natina mi ite ibe mo mako kan ibadin sitatara mol kono mi yalon ko ibe abiba operate kan aka dimile altola ka butal la posole kono aliadi mo ma di alla maybe dol bije comme docteur Cerno ya fa nyame Gambian dol bije mi yalon koy beti atale ike bulo fay nyokan ika bari nyindo hani bi amang tambi hani molbe basse ese do mo ni
gading arjumo tema makoy robi je be solo la makoy rola ka to kudo bi je mi anka akan tardan di wala kudo nyit ka to operation o manka fente mi alon ko achipta because iso ata bagaso la pro operation o iso ata consumables la iso ata kamul bondi nyanta taradula di la nyanta domoro di la nyanta bondi la ke be damin kata operation dollar ol be mu fennede mi alum ka kodo consume so mbe sola la makoy lola momo se min keno na flyer ni na setat no screen o to saying abe na account number ni fanan tandila be number fanan tandila mi alum ko also call no na lafta ka makoy ro ken operational code andum Gambian ol bi jelo mi alum ko be makoy ro ke kan dol bi je man la fi 12 fonds efo be hudi ka mi alon ko be mo makoy ka to ne patient ol ni nini kachata ya moy e kuntum min ka pro problem mo if ibe inspiration of en sota pour ka lafa ka don tol fon la jero don to be lafa la pour ay gëna lafa asambo e gëna wara na mol gëna opérer na campo le soutien la bare sembo ni nga sota
comme na sembo fongo bije sango ko na alto lafta kala se nyaajel
sante na karina ni wo karina ni lafa la campo kala wala na tageto te say
wo sifa abe duno nyen talala bakele banjul ka docteur Chen
so I fo nyame rek so makoyro mom ni momo e makoyro ke no isake so but then that's why the camp we'll be going on the 29th so it's not by coincidence we set the time around that. That's when most of the volunteers will have their salary. Then you realize, so that they'll be able to chip in something to make the thing to be reality. Yes. So basically, that's what it's all about. So now that it's something that we are using. The knowledge, the skill that God gave us to help humanity, we want to go with the public with it. We going out free of charge to district with all inconveniences to conduct safe surgeries. So we want anybody who can to support towards that drive. As you said earlier, a healthy nation is a wealthy nation. And if we are not healthy, it will be difficult for us to move economically. So basically that's what it's all about. And then I can tell you, some Gambians are really not stingy. I was the fundraising chair for this the last episode of the Banjul International Surgical Conference. I saw Gambians coming out to donate handsomely. A lot of Gambians. Q Group came forward to donate, Kairaba, a lot of other groups. The Jawel group. Yes. So and then this I don't think what's the budget line is not up to 300,000. Yes, and then why not more than that is because all the expenditure is on shelter, on transport, on feeding, and there is nothing going out to say you are paying anybody. And then all the people going there are consultants, surgeons, they are specialist surgeons, they are anesthetists, well trained, and then they are perioperative nurses. And then there are very good supporting staff who goes out there without expecting anything in return, with one objective, to make sure safe surgery is conducted. Yes. So that I think this is a worthy cause which should attract the involvement of every Tom, Dick and Harry.
Yes. Thank you, Dr. Jallow. Ayalo Niko surgery in Basse, maybe do be sirin jang. I left a tala, but I am malung a bekela nyadi. Fabi tala le fo Basse, you now come here mean for ila procedure for abina any of the hospital like Serekunda and Demba and Banjun, Purka woke denaning aeta Basse.
Na mol member wala jang wal be la tesol kala janna bare se mol contact na flyer to normal me flyer to pour se recruit no list to na operation list to anu fanang fo mo fana galde dandi bital katung comme na fo nyama sarto le bije min ndati mala dandi mo be opéré so dandi bita fo je na fe ko vitamin sarto so to fe bato demanding la yelo jita wala nyata ni nakala so ese na nang na loptanol to yana mal ko se jibe no ni wisti na tata kol be wanyama den se nyota no base na operation no nkeji
ha ngajele fanang albe yele kuma fola fenko to ko yelo nyanta siala le comme muli fintina fana yena yele diola pour isaje ni operational yeta ko
sako mol mi yalon ko be basta senten mi yalon ko lafta ma ko ro ke la hana re man ko do so te sitano base adjumo wala tosde isa yelo dino campagne to cardinal opero sarto dol fana bi de oro yelo nyata taral di ragato opero mbada falo di yelo ka bonno le so na tara yelo bonta mi yalon ko abe sola pour na yelo la fay pour kana bata pour kanini so momo bi je mi yalon ko na tara hani man ko do so te be min keranoje ese nanoje donation ke 1 pint mi yalon ko amanta fentala li bal ko fana se keno donation put another after mburul le fona fe la molen to we ready to receive put in success that any operation like a success
Ali, how many more jelo ali wala target pour wo operation fo al babula la yele bang fo ali nombre soto mi alon ko lafta wala operate la fo wolungo
ya don tol ka trailer pour nim futata dulato semi operate no the maximum number semi operate no ka wala try pour ka operate bare senten na budget mo 50 at least nen se tambino tan lulu la se min soto no ji alhamdulillah na je kon kam dol bi je kata fonga na budget to nka mun allocate kon la fa kala ka je kon ka siya o fonte so nin fanan hamo molte pour at least ay tambe 50 la bayrin tilikilen no so
Dr. Jallow, you are the only pediatric surgeon. Do you have a supporting doctors?
In Banjul, our list is, our waiting list is long. In fact, that's why this type of charity, when we hear, we join. And then, that's why it was not difficult for us to be part of it and then try to even be in the forefront. Instead of waiting for those kids to come to Banjul, we go and meet them in their own locality. So last time we went to Soma, we did about 12 kids. And then in Banjul, we did 20 children. Yes. So in Basse, we will do the number that we able to do, because we will start the surgery in earnest in the morning until the evening. Yes. So So in fact, it's one of the things that will really help to reduce the backlog. So for example, when I looked at the list we have currently, I saw some of my patients who've been waiting a long time, part of the list. They're all going to Basse, so we'll operate them free of charge. And I think it's important we highlight that. So
okay,
so that this surgery will be conducted free of charge. No patient would pay a dime.
Medicine.
They would be given everything within our ability. We'll try to conduct safe surgeries on them, free of charge. And then we will give them the medicine, any medicine or anything that is available in our hands, free of charge. We would be very happy to spend our time in the locality. We're doing all these things without expecting anything in return. The only happiness we have is we see ourselves going there, conducting the surgeries, and coming back. That's the only yes, that's the only happiness, joy we have out of this whole thing. The reason is it's our calling. Yeah, so it's our calling. We are always happy to do this work
and save lives.
Yes.
Thank you. They showing me that time is 3 minutes left. Dr. Bia, ye mune soto ebe mine fola aning amiso me ya long Gambia no ya long mi ma long follow.
Mbe min la fa la je comme Dr. Diallo ya fa nyame wolong ni operational mbe mun opérer mi manta fen jula na fonata yi nyanta passo jola pour kataje bar operational la ko ndolle be resla be la from ka donation on men soto. So mbe dani roke la Gambia nol biela is fengo feng dino operation on into ndol manjutu fenna isa lafano je ka lafana mulle makko
comme nga fo nyame ne se badu ngete se ake ya mera ko iba di kan amisodle wayatara ina iba di ngo fanange na datara ge ya jere you save another life. Dr. Diallo, quick, they said 2 now I think 2 or 1 minute.
You know, there is nothing more beautiful, more rewarding than operating on your own people in your own locality when God gives you the opportunity to be trained to the highest level. And then the other thing I would add is now in the Gambia we are very lucky. We have a teaching hospital that is able to conduct complex surgeries, to do very amazing surgeries with very good outcome. So now our referral overseas has really come down immensely. So that is it's very good to highlight that that now we are in a very good standing as a teaching hospital and as a country. We are grateful with the Ministry of Health what they are doing. We are very grateful with the hospital, and we have a chief medical director. He's very dynamic.
Yeah, CMD.
Yeah, so
I'm saying hi.
Yeah, so we are also, very lucky in this trying moment to have very qualified Gambian surgeons in the forefront. Thank you.
Thank you very much, Dr. Cherno Diallo, and thank you very much, Dr. B.I. I'm saying hi to the CMD and Dr. Jany. Till we come your way, another edition of Health Check. But any donation you can call, you can check the flyers, you will see the number and the numbers on the GT Bank number. You can donate whatever you have and whatever you can. Itodo? Aissatou Boja. Aissatou bi nata jang pour ila dingola kuola. Mune ketala?
kadino sasala ba sasanye ko jusu sasanye ko ana wuta amman ko afenta ani asura yin ke bare ma kana wuta
ana wuluta altul muntuma la yalon ko jusu sasale bala
kabira be 7 years kabira be dindiare allow around 3-4 months so sifa kanye nayi la katara ka ja ka mane jiyo bona ka sai wayin jaka na ko nyini nyawo nya andun kabanara program 6 months fana so akatari akafen ko sisi moso so ntenga ko bibi so so ni ko asmale bare ngaka nyawo nya abon finde do ma je no ko asmale docteur manene ma fa ko asmale sai alayin saga fo ay 7 years so tumona high fever so o sasa na ta bata ni ta dawo da malaria ne sai ko ndo ma ko asamba jana ahmadiya na asamba ahmadiya ko ni ko ya scan ko sai si fa sa man ko taro ko ta jana ko ma ko nya sai na asamba je bidin na asamba ya na o sasa do to mo le benta docteur do ya scan ko ni ko ni e ji sura ko so daga e ji sura ka ya ta jibi ko ni man ka asma ba ko ni ane ji sura wala
sa in kabre alto le yalon ko diskura ngollem albe mu nekke kanno
nga sambalo tanon to nga sambalo tanon har ban ni be nga sambalo ni ko ni ba fo ni be kata naman ka afmeti mantala bar ba fo wol be tana am sa biri ko diskura on kala ko sa yalo mo jammo ya ka ko ko mo fi jara ro fanan ki tray nga tuwa ya ka ga ngamo nga tuwa so ko bu ka ta ko fanya wande me sirin metti be jata so amboji be kan na ka ngaje ko fenke ko kambane ka men ko ML Foundation ko alka jara ro ke dinnon la me diskura so betum tata je banyinde
so kabrita ta ke tanyale
birin tata je yombulandi la program ko comme ça ka ko e fumo ta clinique sa mbola clinique ta na
bonaje ko e vediates jube kan wala tana ngafo ko jata kende a kumaya tabakele pour ka bondi imaje tena taje fo yalon ibe silol min tala pour kati dimo jar saye mune fo
saye ko anyanta jara tuwa bo manke janne kan to hanen ni ara janne kana ka brinta da ba fo wol ko ko ta Senegal ko nan jiwa skena ba jar la ji waran ko ma dole bije nga dino kiye a sama ta on ta ma ga so nan dino be ta ji bare a ko wonta jara no sainte no do ko ne ko sai be sa fro kala molla ko sa dani ro no kele de ya anta bla be bare ma han ministry sainte en kam ko etente amma me ni do ko kunun fa bota ministry nke ma bota ji ka ko ko ay silo tama me ko ko nase dani ko silo so na ko dino jaro mo do fara nata men jaro ko jang Joshua tuba go don na ndata o fara program fara bolto ko ko kay ya nga ko bere de dada on kente da mat ndol dinno woro la e pere sol ni la dinno ba sai form last week saturday nata ko kay to pindin ka go dinne sama wala chance ko kata to ni ma so
aka batandi nyaade le sai
smala ningi nata fe problem ko qualification le ko to an ka nya no le ka mon ta na mama lija isante silo ate tamata hando moro
amantara ta kan school
abe grade 4 this abida 5 jana hen an mari but because school la jamfo ni ataka ya me taxi tara ka kamma
sa ali l'hôpital soto leba
ko même ta jara
comme yalo e ko ta jara no la ja banta ali l'hôpital soto je leba
l'hôpital wata mi tan de ni fenka yolla kadi fenka ni eme DLK India wol ko nada fo wol ko be taw ko hani pese dum makam soto je bare ko suma ko do
sa ni min lafte ma ko la ni min be ni programme o jube la lafte ma ko la be ko la ni nomba jumal la
asem ko no ni na kim selo la 519 6742
afoko tan
519 6742
kana kumbo ave sone yala le kombade ngol ngako nyamin borom dindi ngolem meta tala ana kata kanana radino ayala jata kende ya soko yaje hani school fango aka batandile na tata school fase taxita ay taaya nata momo lafta ay situ mako la ani ismaila pour dindi woni yala jata kende ya soko ko soma momo alon abe min nafala ye nomba moy la min fo o yente ko 271 9999 2719999 en sembe sambulo ka fulo ka ismaila so ala jata kende yala